Good evening, everyone. It is so wonderful to see this full room of members of the Chicago community tonight. I'm Lauren Henry. I'm Executive Director of UChicago Alumni and a proud alumna of the college, and it is my absolute privilege to welcome you to tonight's discussion about quantum medicine, which is part of our Harper Lecture Series. The Harper Lectures are one way that we continually support the life of the mind, bringing the university's faculty, research, and groundbreaking ideas to our community around the world, and tonight here in Chicago. I always say there are many, many reasons to be proud to be part of the University of Chicago community, right? We can name the Nobel laureates, and we can talk about the faculty, and we can talk about 200,000 alumni worldwide, and all the amazing students who are graduating this weekend. But what makes me the most proud every day is how committed we are to applying rigorous inquiry and the creation of knowledge to address the extraordinary challenges facing humanity and society today, and to truly be guided by our motto, let knowledge grow from more to more, and so be human life enriched. And tonight we have the opportunity to recognize this commitment in action. I hope that all of you saw that earlier today, the university announced that Thea Berggren has made an incredibly generous gift to launch a visionary center in quantum medicine. The Berggren Center in Quantum Biology and Medicine will be the home to a pioneering new scientific field that has the potential to transform patient outcomes. Thea is here with us tonight, so I hope you'll join me in thanking her for her foresight and generosity. And tonight, you'll gain a better sense of where medicine might be headed as we pursue this new field. No one knows exactly what these discoveries will mean day to day for healthcare, but it is so thrilling to know that the university will be at the heart of shaping that path. And with that, it is my pleasure to introduce our panelists for tonight's discussion. Greg Engel is a professor in the Department of Chemistry, the Pritzker School of Molecular Engineering, the James Franck Institute, the Institute for Biophysical Dynamics, and the college. His research group focuses on new strategies to observe, measure, and control excited state reactivity. The group's scientific approach involves parallel efforts in theory, spectroscopy, I practiced that one too, biophysics, and synthesis. Professor Engel is currently the director of the National Science Foundation CUBE Quantum Leap Challenge Institute, a collaborative effort among 23 principal investigators to bring quantum sensing to biology and biophysics. His research has been recognized with National Security Science and Engineering Faculty Fellowships and the Vannevar Bush Faculty Fellowship, among numerous other awards. And, as was announced today, he will serve as the co-director of the new Berggren Center in Quantum Biology and Medicine. Alexander Pearson is an associate professor of medicine in the section of Hematology Oncology at the University of Chicago. Dr. Pearson serves as director of the University of Chicago Center for Computational Medicine and Clinical Artificial Intelligence and the Head Neck Cancer Program in Medical Oncology. He is a Chan Zuckerberg BioHub Chicago investigator and has a joint appointment at Argonne National Laboratory. He is a nationally recognized researcher for applications of quantitative methods to cancer research, and his research lab studies clinical applications for machine learning, mathematical modeling, AI, quantum computing, and systems biology. Dr. Pearson has authored more than 100 research manuscripts in clinical and computational oncology, and he has served on AI and medicine advisory groups to the National Institutes of Health, American Society of Clinical Oncology, American Dental Association, and American Medical Association. Julian Solway became professor emeritus at the university in September after nearly 40 years on the faculty. He has served as the Walter L. Palmer Distinguished Service Professor of Medicine, Pediatrics, and Family Medicine, Associate Dean for Clinical Science Research, Translational Medicine, and founding director of the Institute for Translational Medicine. His research programs primarily address asthma and included extensive studies of airway smooth muscle function and dysfunction in asthma. His research also explored asthma genetics and treatment through mechanistic and therapeutic clinical studies and potential novel asthma treatments. Dr. Solway now leads efforts in the university's National Science Foundation Quantum Center to identify opportunities to translate quantum science for the biomedical community, and, as the newly announced co-director of the Berggren Center, will lead the university's quantum biology and medical innovation along with Professor Engel. And finally, our moderator for the evening is Nadya Mason, Dean of the Pritzker School of Molecular Engineering, the Robert J. Zimmer Professor of Molecular Engineering, and the university's Interim Vice President for Science, Innovation, and Partnerships. Dean Mason specializes in experimental studies of quantum materials with a research focus on the electronic properties of quantum and correlated systems, such as nanoscale wires, atomically thin membranes, and nanostructured superconductors. Her research is relevant to applications involving nanoscale and quantum computing elements. Dean Mason is an advocate for communication and inclusivity in science and can be seen in a TED Talk on scientific curiosity. She is a member of the National Academy of Sciences and the American Academy of Arts and Sciences and was a member of the President's National Quantum Initiative Advisory Committee. And with that, please join me in welcoming our panel.
It's on. Okay, well, welcome everybody. We are extremely excited to see everyone here today to talk about the interrelationship between quantum and biology and medicine and how we are combining them in new ways to develop new technologies and exciting new discoveries. I'm going to get right into it with our first question, and this is for Greg. You know, we hear a lot about how, many of us know how physics inventions such as the laser and the MRI have revolutionized medicine. But the question is, how does quantum fit in? And while you're at it, what is quantum? What is quantum medicine? And why is now the moment to look at this?
So Chicago is not the place where one fades from hard questions, I see. First of all, what is quantum? Because I think this is something that gets a little bit of a strange reputation in the public media. And people like to lean into the philosophy or the science fiction. And I want to discard that. It's much simpler. It's a mathematical model that was invented and that we use to represent some of the smallest particles that we know of. And it turns out that interpreting that and figuring out what it means can be a very disconcerting thing. This lives in the realm of philosophy. But some of the outputs of that model, and I guess I should say the interpretation doesn't affect the outputs. You can think what you will of it, but it makes predictions. Those predictions have been borne out. It's very successful. And some of those predictions are a little counterintuitive. The idea that information can be shared across particles, ideas of entanglement, and new ways to make measurements. And for this discussion, there's really just one thing that you need to know about quantum. It's that there are certain states, like angular momentum states or sometimes energy levels, that are quantized. When things are bound, they're discrete states. Just you can be at 0 or you can be at 1, but you can't be in between. But you can be in both at once, which is kind of interesting. And so that actually forms the basis for what we do. And the way we approach this is we realize that as you can get to larger macroscopic systems where you still have one addressable degree of freedom, something that's binary, something where you can be in both states, you can begin to use that to sense the environment around it. So if you've heard of quantum computing, that's using those types of systems to process information. It's very hard. Why is it hard? Because those things tend to couple to the environment around them. So we look at those same types of systems, but use them very purposely to sense the environment around them. So you take what was a flaw and turn it into an advantage. You look at a qubit that couples to its environment, you put it in a complex system, and you can make a measurement of the environment that's around it. And when you do that, you suddenly have more sensitivity to see what's going on. So quantum sensing for biology marries some of the world's most sensitive metrology with some of the world's most complex living systems. Biological cells, human beings, tissue. And when you can start to make those measurements in that complex environment, you learn something. You see things that you could never see before. You don't necessarily know what you're going to see, but you know you're creating new families of sensors. You're seeing new ways to see what a cell's doing, how they're talking, how you become more than the sum of the parts, how your cells work together and communicate. And then, in some circumstances, you see disease. You can begin to understand what's wrong. You can understand healthy physiology. You can understand pathology. And we're trying to make new generations of sensors that exploit these quantum states to make those measurements and then move them from the laboratory through translational science into the clinic.
Perfect. Thank you. Everyone get that? Okay. Some of it, not all of it. We'll have more. And and a key thing is that the newest and the most exciting discoveries happen at the interfaces between things that haven't necessarily been bridged before. And I'll say for me, I've been on panels for probably 20 years. I've never been on a panel with practicing physicians, which is super exciting. Tells you we're doing something really new. So Julian, as a practicing physician, how did you get interested in quantum?
Well, medicine is fundamentally about solving problems. It's identifying what's the health problem and figuring out what's the best solution, working with the patient, and drawing on everything that the physician and the medical community know. Oftentimes that involves using devices that we don't really understand very well ourselves. I can't really tell you how an X-ray machine really works, but we know the product and how to interpret the result of the diagnostic test, for example. So I think it's very natural that with quantum science now and quantum sensing and quantum computing in both domains, reaching a point where they're suitable for adding to the medical armamentarium, if you will. It's a very natural to be excited about quantum, the prospect of quantum medicine. I'll also add that I confess I'm an engineer. And so I look at people as machines, biological machines, with souls, after all. And so the notion of applying engineering principles and hard science principles to health is not at all a foreign one for me. Indeed, the medical school that I attended was all about that.
Alex, you were working for patients right before this. You were in the back writing scripts for people. Do you want to say briefly how you got involved in quantum?
Yeah, actually, like many things that happened at University of Chicago, was through a student, a trainee, who identified, based on my background in computational science, how we could leverage emerging quantum technology for the benefit of humans. And so, I think this is effectively what the Berggren Center aims to do. And so this catalyzation of concepts revolved around using this emerging technology that was quantum computers to make connections in biology and in biology in the service of human health that couldn't be made with the classical computing architectures that we had available to us previously. So it was intuitive and trainee driven.
Can I dig into that a little bit? So how do you think that tools like quantum sensing and quantum computing may change the way that we treat patients in the future?
Yeah. So, I think fundamentally quantum mechanics, quantum events happen in biology all the time, right? Every moment of every day. And so I think that when we have sensors that are designed to probe these inherent quantum principles in living systems, they will allow us more granular, faster, higher resolution output so we can make decisions on behalf of patients. So this might be in the developing a sensor that can, with subcellular resolution, understand the physical properties in a cell so that my colleagues in the surgical suite know that they've resected enough of a tumor or not. Or it might be with quantum computing to build a better, a more effective medicine by more efficiently designing the shape of a small molecule to fit in a binding pocket that it needs for a target that it needs to drug. So these are ways that we could improve diagnosis or improve treatment on behalf of patients using these new types of technologies.
It's incredible thinking of actually manipulating things at the cellular level and understanding in a way that I assume that no other tool can do right now.
Yeah, exactly. I think there's no way to get that instantaneous readout at the subcellular level in real time with a living cell system. I mean, to be able to probe that intrinsic property of a cell is just going to be remarkable for all of our medical subspecialty applications.
Yeah, exciting. And speaking of exciting and moving forward in this field, let's talk about the Berggren Center, which we're really thrilled to announce today. Julian, you're co-director of the Berggren Center with Greg. Can you tell us a little bit about the vision of the center and whether we expect to see quantum devices in every ER and whether every doctor from now on is going to be a quantum specialist on the side?
Well, our deepest thanks for making this possible. The center, I think Greg and I are thinking about three fundamental aspects of the center. One is in training the workforce to be able to do quantum medicine, and that will focus on MD, PhD, and perhaps MD only physician scientists who are aware of and well steeped in quantum systems and science so that they can work closely with other quantum scientists who might be from PhD heritage in order together to develop new applications, devices, diagnostics, potentially even therapeutics, and in the realms of both sensor-type devices and quantum computing. Another aspect is to advance the science of the quantum and the technology of quantum devices, and that will, of course, be heavily dependent on working in the science realm, guys like Greg and colleagues, along with the physicians to help keep them informed of the likely biological and medical relevance. And the last is adoption, of actually taking all of this new knowledge and turning it into real-world uses and wide application and general use in medicine. Now that's, of course, a longer-term prospect. It does take a long time to translate new knowledge. That's the term used for taking any kind of new knowledge and turning it into improved health. That's a long process. Perhaps we can discuss that later.
Or perhaps now. Let's let's follow up. Tell us something about what are the new medical technologies or breakthroughs that are possible, that are most exciting to you. And this is for all of you at some point, yeah.
Well, I think that the striking breakthroughs in quantum medicine are just very nascent. Right now, the applications of quantum devices in medical practice, there are some, but they're very nascent and they're limited in application. There's a fetal magnetocardiography, for example, that's better than electrocardiography for detecting fetal arrhythmias, disorders of the heart rhythm. But you know, you can name a handful like this. I think in the future, as Alex was alluding to, there's just enormous potential. I have my favorite examples. I would like to detect hypoxia, inadequate oxygen, throughout the body and map it. Boy, would that be useful for critical care physicians and for cardiologists and everybody studying disorders in which there isn't enough blood flow or disordered metabolism and so on. And one can imagine this happening and not that far into the future.
Alex, any dream applications?
Yeah, I'll share one with you that I think will be the first, maybe, out of my research group, but we're involved in a Chicago-based consortia that seeks to deploy quantum machine learning to human health applications. And so this is part of a grant that we've been very successful at renewing. And the grant is very aggressive in terms of its timing. And they said, we want you to mount quantum information on quantum computers and come up with a biologically relevant output in 3 years. And so we're a year and a half into this grant. And as many of you may know, these computers are like barely existent, right? So we're actually close. We've developed a problem that we think will be relevant to pick signals from DNA mutations, from gene expression information, and from pathology images simultaneously, and to combine them with algorithms we've developed and mount the selection routine on a quantum computer. So I hope at the end of this, I hope to report back in the next 12 to 18 months, based on what my grant officer says, with the results of this potentially first quantum biomarker for cancer. So that's what.
Super exciting. Yeah, congratulations on that. And quantum computers exist; they just don't work all that well. And and what we need are people co-developing the technologies with the computers, the biology with the quantum, to really make progress, like you're doing. Which leads me to my next question for Greg. You direct the NSF Quantum Center for Biophysics and Bioengineering, which has made some of the fundamental discoveries in this area of quantum biology, and really something that led to the development of the Berggren Center. Can you say a little bit about what your center, Cube, does and some of the breakthroughs that you've had there?
Sure, happy to. So one of the things that we realized was that as the people who develop quantum sensing, they're physicists. They're interested in setting records for measurement, the finest measurement of a magnetic field or an electric field or temperature. And they don't usually think about imaging hypoxia or understanding malignant metabolism or seeing when an immune cell triggers. In fact, they really don't think about that. They don't even know how to think about that. And meanwhile, we have biologists and physicians who desperately want some of that information in certain circumstances, but wouldn't know how to make the measurement, so they do the best with what they have. And our idea was bringing these communities together, realizing that there was something that they could both add if they could talk to one another. And it turns out, long story short, they can't talk to one another. So they speak different languages, they're very different cultures, they're different styles. But when you take a young student and you put them in a lab between these different PIs, and they grow up there and they feel like they're a full member of both spaces, they're translators. And those students are the ones who bring the ideas back and forth. And once they capture the attention of the physicist, when the physicist realizes, oh my gosh, I could make something that really matters, that'd be fantastic, then they're all in. But getting to that point is hard. And so we wanted to bring people together to think about the opportunities for this technology. And you were asking what some of the first measurements will be. Let me share some preliminary data that's not yet published. I'll be a little careful about IP, but we started looking at some quantum sensors made out of small pieces of diamond, and we started putting them in cell types where you wouldn't usually measure electricity. Like you've probably heard of neurons, you know that they fire electrically. But your immune cells are also electrically active. They're just very hard to measure because they move around. And everyone can probably tell me after COVID exactly how a T cell might trigger on something with a T cell receptor. But that T cell's electronically active. You can trigger it electrically. It's just hard because usually your wire is stationary. We put our sensors inside, and we can watch the electrical triggering of this. We can watch this immune cell determines whether something is self or not self, which is an amazing chemical problem because it's trying to figure out if it's something that is not part of you, and yet it's something that it hasn't seen before. And that chemically, molecularly, it's very hard to recognize something that you've never seen before. That's he was talking about making a molecule that binds to a target. but how do you make one that you don't know what it binds to? And how do you tell if something is not self? And we can watch that process, and we can watch it trigger in real time. So we made the first sensors to do that, and we can prove what we're seeing. And now suddenly you can go into a biolab and you can begin to look at organoids. You can begin to incorporate immune cells into these very complex tissues and begin to see how the immune system attacks a tissue. And if you're interested in transplants, that can be very important. You can see how an immune cell attacks a pathogen. If you're interested in getting well, that can be very important. And these are things that we knew they did, and we even have a pretty good idea how they work. No one's ever been able to see it at the size of an immune synapse. You've never been able to go in there and actually make the measurements. We just know what happens before and after, and if we knock something out, why. And now you can watch it in real time. And so we're beginning to see those measurements come online, and it's teaching us something about immunology. It's teaching us something about biology, and we'll know how to target disease better. So there's some applications in the clinic, like measuring hypoxia in the body. There are applications ex vivo, calculating new molecules, or diagnostics in the laboratory. And then there are research tools that let you see biology in a different way and know what to go after and know how it works. So you can begin to understand the problems that you couldn't even frame, the questions you couldn't even ask before. And that's kind of the most exciting part. We're being taught to ask questions that we didn't even know to ask. It's not answering questions that we knew about. It's just asking fundamentally new things about how it works, because we can see things we could never see before.
Yeah, and that's the beauty of both just discovery and directed discovery that allows you to think of things that find things you may not have known. And just to be clear, what's quantum about this? You have these sensors. Is it the size? Is it the sensing?
Yeah, so it's this little piece of diamond, and diamond, it's hard, it's abiologic, but it's really a very perfect crystal in a lot of ways. And then you can have a vacancy, one atom out of place. And this, as it turns out, carries what we call spin, which is an angular momentum, something that flips up and down. We can optically see it, so we can use light to tell what's going on. That's how you get the information in and out of the cell. And we can use a magnetic field and a microwave to cause it to flip up and down. And it turns out the dynamics of that depend on its surroundings. And all of a sudden, you can use that flipping of the spin up and down, which you can see with light, to tell what's happening in the environment around it. And it turns out that it's incredibly sensitive to pressure, to electric field, and to temperature. And so you can measure metabolism. You can measure that electrically excitable cell and watch the immune cell trigger. And you can measure pressure. You begin to see how the tissue actually responds at a macro scale. And so the piece that's quantum is that little spin associated with the vacancy. And that's not important for biology in this instance. What it's important for is getting the information out about the biology. So we use that as a tool to learn about the environment around it. And we'd never be able to make that measurement if it weren't for the quantumness of that spin. And that teaches us about the environment that's around it.
Thank you. Yeah, so quantum really enables a fundamentally different type of measurement that we couldn't do otherwise.
Absolutely, with sensitivity that we couldn't access in any other way. And then we can put it in an interesting place and learn.
Which is why this is so revolutionary. Okay, Julian. So we're trying to take these quantum discoveries, and ultimately we want to put them. We want Alex in the back there writing quantum scripts, right? Not just regular chemo scripts, but about what quantum technologies to use. So what are some of the challenges for doing that? How do we get from quantum technology to from bench to bedside here?
Yes. It does take a very long time, traditionally, to take the sort of new knowledge that gets developed, say a new potential therapeutic drug, to take it through testing to make sure that it works, that it's effective, that it's usable, that it doesn't kill anybody, and then get it adopted and actually used. Typically 17 years for a new drug. I imagine that quantum technologies are also going to take a long time, but some of them will be fast-trackable because those that are applied outside of people won't have any toxicity issues or delivery issues. So, for example, imagine a new quantum microscope in which quantum sensors are used to detect individual proteins or individual pieces of nucleic acids. You've heard of mRNA vaccines, and maybe individual metabolites, and maybe individual different lipids, and do them all at once at the same time. That would be transformative. There's a technique called immunohistochemistry, in which colors are used typically to label antibodies that are directed to a lot of different cell constituents, and maybe 60 or 100 of them could be used. In principle, quantum sensors could be used at much greater scale. Indeed, I think that the promise of quantum is both to enable brand new sensing of things that we couldn't sense previously, but also, like with quantum computing, to do things faster, better, cheaper, and at scale that wasn't previously possible, and thereby really expanding the power.
And we have to work together to do this. And I've worked with physicists and chemists for many years. I've not worked as much with doctors, so I have to ask about bedside manner. And what I mean by that is, are there cultural differences between physicists, chemists, and physicians that you have to work through? You guys have all worked together on the center before, but what are some of the differonces in bedside manners, or lab side manners?
Benchside manners.
Lab side manners.
Yeah,
Let's just focus on that. Are there cultural divides we have to think about in implementing quantum technology in clinics, for
I
example?
feel like I'm about to get the short end of the stick.
You'll go next, Greg. You can answer too.
Dean Mason, let me say that right now, that very quandary of how do basic scientists of any stripe, biological basic scientists, talk to clinicians who aren't biological basic scientists, and vice versa. And it is that coming together, the learning of each other's language in a sufficient degree to communicate effectively. And I think that that the approaches and daily routines are widely different, but the goals are all the same. And so that's the unifying and beautiful part of our field, that everybody is trying to make the world better.
I love that. Do you want to add anything?
Yeah, so at risk of getting myself in trouble, you don't want me as your doctor. I have no bedside manner. I'm a very good chemist, but and I can do things that people, I can kill cancer very effectively. It's that saving the patient part that turns out to be really hard for a chemist. So I do not have touch in this way, but it's great working with people on common problems and seeing the things that they struggle with in the clinic, and then think about and dream about how you would solve those problems. And so that's what I like about this collaboration, is I don't need the bedside manner to dream about what might make their lives easier. And they would never dream of letting me into the clinic. And this is a very fair and equitable relationship.
I love that. Okay, Alex, as I think we're all on the same page about the promise of quantum technologies in medicine, but as we apply these quantum tools to biology and medicine, are there other sorts of ethical or legal issues that we need to think about? For example, could this affect disparities in who can afford certain types of healthcare? Only the richest people going to get the quantum medicine and the rest get nothing.
Yeah, I mean, these are great questions to ask ahead of time rather than sort it out after, right? I think in our lab, we currently are working with artificial intelligence-based biomarkers, and we're fond of saying an AI biomarker is just, a digital biomarker is still a biomarker, is just a biomarker. And I think we'll see something analogous. A quantum biomarker is still a biomarker. And what that means is that we, as wearing our physician hats, are still mandated to perform the research that develops the tool with the same ethical standards as we would be doing within a classical domain. So I think that as we uncover more, you've heard about all of the different signal that a nitrogen vacancy diamond might be able to detect simultaneously. Magnetic field, temperature, and other things. So what we need to be able to make sure that our detection is sensitive to one of those signals and not all of those, or that we're not conflating these things. And all of this will be part of our research rigor over time. I mean, I think in the short term, the technology to develop quantum techniques is very expensive, very boutique, very time consuming. But that is not the way we see these technologies being applied, right? That's not something that's going to be disparity increasing in the long term. It's going to be, I think as a community, we're going to be able to reduce disparities if we're able to use new tools to improve the care of many people. And so it sometimes takes expensive investment in order to come up with cheaper solutions to human health problems. And I think that's the way we look at it within the center, looking forward to a future state where we have better tools at our disposal.
Thank you. Agree. Please, go ahead.
May I add that an event like this, in which we have an opportunity to talk with folks who I'm going to just presume are not all quantum medicine types yet, the public, the community, it is so important for the quantum physicians, scientists to be engaged with and hearing from the community. Look what happened with mRNA vaccines. The rollout was abysmal. And people end up thinking that, chips are being implanted. And that's because there wasn't enough genuine, open engagement and conversation between real people and the scientific community. And I hope that we are not going to do that with quantum medicine. I'm quite sure that we are going to try not to let that happen.
And we all have to work together to make sure that new technologies that help us are adopted, that help health overall. Right? We are sadly running out of time already, so I'm going to go to my last question, and I'll ask all of you, but I'll start with Greg. So what is the future of quantum medicine? If we're sitting here in 5-10 years, if we're sitting here in 2030, 2035, what will we be talking about?
So my hope at that point is that you in the audience will recognize that you've benefited from this. That's really where I want it to go. So what are the earliest types of technologies you'll see are catheters that have a quantum sensor at the tip. You will probably never know that your drug was designed with a quantum algorithm, but you'll know that it works quite well. You may not know how we develop the immunoengineering techniques to help your body recognize cancer, but you'll have heard somewhere that someone was able to watch what was going on. My hope is actually that you are never sick enough that you need the experimental treatment and that you know you're getting the quantum sensor, but that you benefit from the knowledge that these sensors can create. So my expectation is that doctors will use these types of tools, some in the clinic, but often asking themselves, what piece of knowledge can they not get today that they really want, and know where to go to develop the sensor to get that so they can improve human health. And the patient doesn't necessarily need to see that process. So my hope is that we cause medical advances to be faster, we cause treatments to be cheaper, we cause procedures and treatments to be more accurate so there are fewer negative outcomes for people. And we hope that most patients never need to know that they're exactly on the cutting edge. Our hope is that we can intervene earlier, we can be more sensitive, we can see things before they become existential, and we can treat them more accurately. And ideally, that keeps costs down. That creates better outcomes for patients, and people don't necessarily know. There are good examples of this. Think of an MRI. That's actually flipping nuclear spins in water, and you're imaging the water in your body. It's an older technique, but so many exploratory surgeries are avoided with that technique. And why is it not called a nuclear magnetic resonance machine? Because people didn't want to go into it when you put the N in front. So they just dropped the N and make it magnetic resonance. So this is where you have to talk to people. And you may not know that they're actually flipping the nuclear spins in the water molecules in your body when they take that image, but that's exactly what they're doing. And I hope that the next generations of quantum sensors that are really based on individual quanta will be similarly sort of transparent to the end user, but similarly effective.
Perfect. Julian, 30-second, next 5 to 10 years.
Oh, what Greg said. I think he summarized it beautifully. There's great anticipation, great promise, and great uncertainty. It isn't like we are sure that this or that application that we've mentioned or approach that we've mentioned is actually going to be the one that turns out to be useful. Indeed, history often shows that things that maybe weren't such great ideas turn out to be really good ideas and impactful. We'll see.
Alex?
Well, I'm a physician, as you've heard, and I'm all about end results. So in my field, in the last 1 month, we've had our first AI-generated companion diagnostic and our first positive phase 2 study with a AI-designed drug. I think that we're only in an acceleration period, and that I'm thinking 5 years we'll have these quantum equivalent FDA-approved or FDA-cleared devices in each of these domains. So that's what I'm looking forward to.
I am excited for that, and we will be back here in 5 years talking about all of that too, and maybe even before. So with that, we're going to end the panel part, and we are open to questions from the audience. Oh, do I have to choose? I think they're going to choose. I'm just the moderator.
Hi, my name's David, and my question, how do you overcome the signal-to-noise ratio coming out of these very sensitive sensors? Using the conventional ones, we have enough problems as it is, but with these very, are you using FFTs or using like things, more speculative approaches?
Yeah, so I can take that one. Typically, you need high fidelity amplification. So often what we're doing with these optically detected systems is we're pumping and repumping, so you're getting many fluorescent photons, and then with your microwave, you're modulating the fluorescent signal, which allows you to use a lock-in amplifier to pick it up. And you're in areas that run from 3 gigahertz to 400 gigahertz, and we develop new high-speed electronics to do that. And that allows us to isolate the signal, even from single emitters, with very high fidelity.
Specialized techniques that are getting better every day.
That sounds better than what I said.
But there's someone here who had the very first hand up, I think. Yeah. You with the blue shirt. Blue shirt. Yeah, I think that's. Oh.
We have somebody back here.
You have, okay, never mind. I'm not going to try to do that. Go ahead. Do your thing.
Thank you for the panel. I'm Smitha Aragapudi. I'm a lab alum. I have a question about patient safety concerns generally, but specifically the example that you gave about detecting hypoxia or hypoxemia as well. I didn't understand exactly how that would work, but I understood things about the diamonds in the cells, and I'm curious if you put a microparticle or quantum particle of diamond, what concerns would there be with response from the human body? So safety plus the example of hypoxia is really meaningful beyond ICU. It's meaningful in anesthesiology and daily surgery. It's just, that would be in sepsis and ICU considerations, it would just be so impactful that it's hard to really explain. It's so big.
I'm delighted that you bring that to the fore. That is exactly why I'm excited about it. Hypoxia is one of those broad processes involved in disease. The fibrosis, pressures, proliferation, cell differentiation, immune mechanisms. And so a tool that could give you insights into where is there hypoxia in the body could have many, many applications. And I'm a lung doctor, and you can just imagine how excited I wouldn't be about inhaling a bunch of diamond dust.
That's not the proposal. Let us be very clear. Even from me, that's not the proposal.
Does coal miner's lung ring a bell? I mean, so clearly there's a great deal of refinement and design that will need to be done. Very excitingly, one of our colleagues, Peter Maurer, is developing ways to use proteins as the quantum sensors. And so with just saying that, you can imagine the potential if that technology could be made much more universal than it is right now.
Hi, Roger Moore. I'm a professor in the Master of Applied Data Science program. I'm a geek, but I'm not thinking that I'm going to find out much information going to, kind of quantum molecular journal. And you talked about trying to get the public to understand this. Where does the public go to start understanding what's coming of this, what's going on in a way that we can understand?
Oh, he's looking at me. Okay, so it's right now. It's actually very hard because we don't have a clear example where I can hold this up and say, "Here, you need to learn how this works." Instead, what we're seeing is that ideas that have been seeded by discussions across fields are starting to pay dividends. So he mentioned the unpublished data about using fluorescent proteins as quantum sensors. This addresses a lot of the kinds of questions about inhaling abiotic materials or expressing them and knowing exactly where you are in the cell. When you put a piece of diamond in the cell, you don't know what's next to it. You don't know what's around it. A cell is a very crowded, disordered, squishy kind of place. You attach the protein using genetics, and suddenly you can attach your fluorescent protein to your target, and you can watch it, and you can see it. And so we're starting to see papers like that come out. The first ones are going to be in headline journals like Nature and Science, Journal of American Chemical Society. There's a red fluorescent protein with a giant magnetic effect that was published about 3 weeks ago by one of our collaborators. And so you're starting to see this leak out. I think the thing that we want to communicate right now is that there's opportunity, that these fields are coming together, they're on a collision course, and there's opportunity to do something impactful. And we want to take people along with us every step of the way. It is not at the point where I can show you a technology and say, "Here, learn how this works, you're going to benefit from it," and have that sort of exemplar. We're still building that airplane as we're flying it, but we want you to see what we're doing. We want you to see how we're approaching it. We want you to see the care that we're taking in developing these things and making them safe and making sure that we are making high fidelity measurements that give us the right information that people can rely on. And we want that trust. And so we're an open book. We're showing you every step of the way. And right now, you'd be looking at premier science journals, searching for words like quantum sensing, biology, NV centers, and you'll see articles. You'll see a lot on nanodiamonds and NV centers with microscopes, but it's not really a good way to do biology. And so we need the next generation. And so we were very proud of our measurements. We talked to physicians, and they just kind of shake their head at us and think, if you're putting diamonds in cells, it's not good. You shouldn't be putting rocks inside cells. That's a bad idea. The folks at De Beers are fine with it. But, other than that, you want a better tool. And so we set out to develop a better tool, and that's going to come out in the next few weeks. So you'll see some headlines on that in maybe a month or two. I mean, it's hard to tell in academic review. You have to get your peers to sign on. But, this is coming. And so you'll see some of these things trickling out, and we want you to follow along. We want you to be part of it.
And
There'll be press releases in the popular press when those papers come out.
And it's also how long before we see it in popular press in the news, and there's articles already coming out. I also want to mention we have websites. So CUBE has a website, QUBE. The Berggren Center has a new website. You can look at the Berggren Center at the Pritzker School of Molecular Engineering. And so a lot of the highlights of this and explanations and basics are on our website. So go to the PME, UChicago PME website, go to the CUBE website, and you can see a lot of information there.
Colin Anderson, MBA. How do you didn't talk about the cell biologists. Do you have cell biologists in your team? And how do you interface the computational with the empirical that comes out of that?
I think all of our groups, I mean, there's all good science these days is team science, right? And so I think that we are all part of consortia that bring our unique individual training into these teams with this shared language, or this drive at least to learn each other's languages. So when you're hearing about some of the sensors that Peter Maurer is developing, that's someone I collaborate with, and my lab marches our cells over to Peter's lab to give some context to the signal that he's developing with his NV diamond sensors. So especially as we push the frontier forward, all of the teams are going to have expertise to make sure that we're not just evaluating signal for signal's sake, but that it has context that is intrinsic to the application that drives the center that we're all part of.
Susan Gray, I'm, I guess, a science nerd. We're talking about technology here. I would like to follow up on that question and say, are any of you thinking about quantum phenomenon within the cells? In other words, you talked about spooky action at a distance. You talked about entanglement. Are there people looking at what's going on in the cells at the atomic level? I know we look at the molecular level. I did that. We look at the atomic level and say, are there quantum effects at that level? Or is anybody doing that? I'm just curious.
So my lab for years has looked at quantum effects in biology before turning to quantum technology for biology, a little bit different. So we were looking at intrinsic effects. One of the challenges is that you typically have to probe it with light to get the information out. And to a good first approximation, we're reasonably transparent. But when you go to something like photosynthesis with chlorophyll, you begin to see these effects jumping out, and you learn how the electron transfer chains work. You learn how energy transfer moves through quantum pathways. And then you can begin to think about how to implement that in similar systems that operate in reverse, like in the mitochondria. And people are thinking about this. People are looking at those effects. And those are very interesting processes where we think we can actually use our quantum sensors, which are light-driven, to probe some of these types of systems in human cells that are not light-driven. So while photosynthesis is biology consuming light, your mitochondria doesn't give off photons. It's very hard to synchronize it to see a quantum signal. So it's not that the quantum effect is causing disease, it's the biology has evolved to take advantage of quantum effects because biology didn't read the textbook. It doesn't understand if it's quantum or classical. It just evolves what works. And so there are processes where we don't know exactly how the electron moves. And we do know when there's a defect in that process that there's a problem, but how do you engineer it away? How do you treat it? How do you deal with it? These are things that we're hoping to be able to get out of it.
Maybe I can add that, quantum is everywhere. Every atom follows quantum mechanical principles. I mean, every aspect that we know of how the electrons move around atoms, which is the basis of every electronic device and every material that we understand, all of that understanding is based on the principles of quantum mechanics. And so what we're talking about here is not understanding, using principles of quantum mechanics in biology, but really new properties of quantum that haven't been used as devices or tools before. So when Greg talks about energy levels or superposition and entanglement, these are things that we've known about atoms, but we've not used them as tools for new technologies until really the past couple decades. And so quantum is in cells. It's there, but cells, they're relatively big compared to just individual atoms. And so you don't really think of it as quantum as much. But now we're applying tools of quantum understanding of quantum to really get greater access to curing diseases and helping people. So maybe last one.
My name is Elizabeth Hatton. I am a complete layperson. I'm just an enthusiast. But I had a thought about the issue of infrastructure regarding quantum computing specifically. I was wondering, is it possible to build a quantum system within the quantum system? So like creating an emulator, for example, of a quantum state within a quantum computer, and being able to utilize that to expand the singular location into like a dual boot system would be my analogy for that.
I think it's possible and not possible.
Well played.
But now I can't back it up with, I mean, I think one of the things that is really exciting is that Chicago is going to be able to capitalize on this global center of gravity that is quantum computing as we build the infrastructure on the lakeshore. And as we see an emerging set of computing startups to drive this technology forward. So there is no better place to ask this very deep question that you've posed to us than Chicago, because this is going to be where the thought leaders in quantum come and where the startups develop from in order to drive the technology forward.
I'm not as eloquent as Alex, but quantum error correction is the way people solve the fact that our qubits are imperfect. And what they do is they create a logical qubit, which is an array of many physical qubits. So in that regard, it is a qubit within a qubit, so to speak. And we can use that with error correction algorithms so that these systems can scale towards a universal quantum computer that can solve anything rather than purpose-built quantum algorithms. And so in that regard, it is sort of a quantum computer within a quantum computer. It's just that one of them has many more bits and they're noisy, and the other has fewer bits but they're clean. And often if you want a high-fidelity calculation that can do something complex, you need those cleaner logical qubits. So people do that.
Hi, can you hear me? Okay. First of all, good evening. My name is Drew Wade. Let me put in the, first of all, disclaimer. I'm not a scientist. I'm not a physician. I'm a sci-fi enthusiast, to be quite frank. And I've actually, I'm already living in this vision called a North Star of a day when, quantum is actually every day, bedside and so forth. And I've actually envisioned a day when it's used to, for example, it's like I see the obituary of cancer, like cancer's just done. We won the battle, right? Whenever that date is. But I'm already in my mind living that. Actually, I wrote about it. But with that said, there's been obviously a lot of talk. I mean, I've been to different events, modeling all these proteins and molecules and so forth. And we've talked about that, like the machine of systems. But my question pertains to mental health. And one of the things, that I see is that, there's a lot of simulations being done, and being able to, from my knowledge, again, my disclaimer taken into account is that we don't know as much about the mind, we know very little even per se. But what I'm excited about is that at some point, when we're in that date and it's online, we'll be able to actually model and simulate and do all kinds of things with regards to the mind. And this is where I'm going to make the leap where I put the disclaimer. I feel that there's a connectivity between, like mind, body, and soul. But let's just say the mind and the body and the physicality, maybe even disease and different things, beginner end or, with the mind. And so with that said, in terms of a roadmap or a North Star, is there anything out there from a mental health perspective where if you could just, you're sitting in front of Santa Claus and, push the button and, to focus on as far as using this powerful technology or massive breakthrough in humanity for solving things about our understanding and how to, do things around mental health?
Yeah, I think mental health is one of the most challenging aspects of medicine to map because it's so challenging to develop the phenotypes, the language to describe those contexts, right? I think that from my perspective, and when we apply quantum computing, the areas that we think that we might get some advantage in are times where there's a lot of connectivity between different types of data and where data collection is very expensive. It sounds to me that this would be a good type of technology to apply to these challenging problems, right? Where the truth is not known or partially known, that you would get incomplete information, but from a lot of different sources simultaneously. I think these are great applications that we need to be thinking about because it's so widely applicable, right? We talked about equity. What more equitable than mental health that affects every portion of every population of Americans?
And I just want to add that our newest hire in our School of Engineering is a scientist who studies immune responses in the brain at the cellular level, and is developing new tools to do that. Right, so he's an engineer, an immunoengineer, who's developing these tools to study brain inflammation and responses, which is responsible for a lot of different issues in the brain. And so I don't see any reason why, as you develop those new tools, one of those tools couldn't be a quantum-based tool as we get more and more sensitive in the future.
And I would imagine that multiple lines of quantum applications will be brought to bear in the study of mental health in the realms of sensors and computing and even potentially interventions. Alex, I've heard you talk about killing individual cancer cells with quantum-based tools. It could be that there are individual neuronal corrections that could be done. Who knows?
Yeah. I have one more question, last one.
Hi, so my name is Bradford Boonstra. I'm an alumni of the university. I do have a physics background, but please make the answers to your questions accessible to the general public. I think my primary question is, I'm gathering that your quantum sensors have primarily, you had mentioned before that they were light-based, and so I'm assuming that's electron transitions between energy levels and all that jazz. Okay, so I guess as an allegory to say MRI machines, in an MRI machine you use like the wobble of the proton or the wobble of the water, right, to figure out where the density of water is, and then from that information you can create images and you extrapolate information. I guess my primary question is, from this information that you're gathering, from these cells or from these electron transitions or whatever, what kind of secondary, I guess primary and secondary inferences can you draw? Like what does that tell you of the cell, and then what inferences can you draw from that raw data that you're getting? And I guess a secondary question is there any sensors that you're creating that rely on different quantum phenomena rather than like electron transitions?
So you're correct that the way we do the sensing is through electronic transitions, and that way we can use light to communicate with this small molecule that we put into a cell. And then you're also correct that it wobbles is a pretty good word for it, but we use electrons. The electrons wobble rather than new nuclei, and that's how it differs and is at much higher frequency than MRI. The key element of it is with MRI you have millimeter scale resolution. You can see tissue, but you can't see cells. We're getting down to resolution on the order of 30 nanometers or so, which is, that means that our scale is so much smaller than this 10 micron cell that you can begin to see what's happening at the subcellular level. And that's very important. You can ask how drugs partition within a cell. That's not the kind of question you can get any other way. And you can watch it in real time while the cell is alive. You're not trying to, slice it or do something destructive. And so you can watch these types of information. But we do it and make it optically detected because you can detect single photons. Our detectors are good enough that we can get extremely high sensitivity, and then we can use signal processing techniques to extract the information, even though it's coming from a single particle. And that's the piece actually that makes the quantum interesting, is that you just have one particle rather than a whole slew of them giving you your signal, and that allows you to know where you're seeing something, when you're seeing it, and where it's coming from, and put it in context, but able to do it at the nanoscale.
And at a rather larger scale. So I've studied asthma for my whole career, and asthma is a disease in which these boa constrictors of muscle that encircle the airway tubes, they squeeze down on the airway, turning it from a big pipe into a little teeny straw. And that's an acute asthma attack, and that, of course, makes it very hard to breathe. Now, we know in the lung that branches and branches and branches for 23 generations or so of different daughter airways, that bronchoconstriction, as it's called, the squeezing of the boa, is very heterogeneous. Wouldn't I love to know where that is happening? So give me a quantum sensor that senses pressure that I could use to detect local muscle contraction. And that will transform the way I understand how the whole integrated lung works. The fact that it's a quantum sensor in this application doesn't matter, except that you can't do it any other way.
So it is time for us to end, sadly. I'm going to make one final statement, which is that I think that we all believe that quantum medicine and biology is the future. And while we don't know exactly what that future will bring, I am 100% sure that these scientists and their colleagues are going to make sure that that future leads to better and more healthier lives for all of us. Can we thank them one more time for this great panel? Thank her.
And it's Dean Mason's job to ask you all to thank them, and it's my job to ask you to thank her for a wonderful conversation. I am all that is standing between you all and dessert and further conversation. So I am just going to say one more time, thank you to all of you for the great questions. They were actually questions, which is not a guarantee with the University of Chicago audience. Thank you so much again to you, Thea, for just I just keep thinking about how this conversation is going to move forward and accelerate because of the support. Stay in touch. Go to the alumni website, go to the PME website, go to the UChicago Medicine website. Enjoy the evening, enjoy the conversation, and thank you all so much for being with us.